We'll talk about another medical procedure, and this medical procedure is known as what? Hemorrhoidectomy. All right. So hemorrhoidectomy is just the same concept as what? Hemorrhoidopexy. All right. Hemorrhoidectomy, hemorrhoidopexy. So all of them just have to do with what? Trying to repair hemorrhoids. Okay, we have spoken about hemorrhoids on this channel, where we said we have two types of hemorrhoids. We have internal hemorrhoids, we have external hemorrhoids. Okay, so if you want to now correct these hemorrhoids using the surgical way of trying to correct it, the surgery done for this is known as what? Hemorrhoidectomy, also known as what? Hemorrhoidopexy. All right, so let's discuss the surgery, all right, under several headings. So you can see these pictures is just like the right way of placing the patient for this type of surgery. You could say lithotomy, or you place them like this. All right. So for the definition, we say that what? Hemorrhoidopexy is also known as what? Hemorrhoidectomy. Okay, or is known as what? Power repair. All right. It's a surgical procedure to treat hemorrhoids. Hemorrhoids are what we call piles. All right. So indications. When should you do this type of surgeries? If the pile is going to grade 3 or grade 4, right? So when it's at grade 3 or grade 4, that's when we are saying there's a prolapse, all right? When there's grade 3 or grade 4, that's when you're saying there's a prolapse, okay? So if the patient is having a prolapse, then you might want to do surgery just to save them, right? If you have been doing conservative management, but the conservative management is failing, they know that surgery is always the last option for every disease condition, right? Then if you have a recurrent or persistent bleeding, that means you are treating the patient is coming back. You're treating them is coming back. You're treating them is coming back. Then you might want to opt in for a surgical option, right? Then if the patient has a painful or thrombosed hemorrhoids, all right, basically if the pain is too much, all right? So procedure, how can you be able to do this type of surgery? So the pre-operative preparation, that's pre-operative, that before the operation. You do bowel cleansing, antibiotic prophylaxis. Prophylaxis is like you giving a medication before time. Okay, so you can just give it before time so that to avoid any bacterial infections and all that. Right? They could give them anesthesia, could be general anesthesia or regional anesthesia. Okay, surgical techniques. This hemorrhoidectomy can be done either through the open hemorrhoidectomy, closed hemorrhoidectomy, stapled what? Hemorrhoidopexy, or transanal or hemorrhoidal desarterialization. All right, all these are the different surgical techniques, right? So you actually go in depth in all this when you are like specializing in surgery and all that, all right? But for now, it's just good that we know that such things actually exist. All right, so post operative care, now that's after the operative care. We give what? Pain management, wound care, dietary modification. All right, then for the types of what? Hemorrhoidopexy, we have already spoken about it under the surgical techniques, right? So look at this place again, and I think, okay, next will be complication. This is surgery, of course. You are invading the person, and there will be risks of what? Bleeding. All right, it could lead to infection too if the surgical area is not sterile, right? Lead to urinary retention, fecal incontinence, and anal strictures, right? Contraindication: if the person has a very active infection, all right, you should treat via the conservative measures first and try to like what? Downstage it before you opt in for surgery. If the person has inflammatory bowel disease or severe cardiovascular disease, or if the person is pregnant, you could just wait for all those conditions to subside before you actually what? Initiate the surgery. All right, so that's it for what? Hemorrhoidopexy, also known as what? Hemorrhoidectomy.